Instruments required: two plain forceps and one artery forceps, one butterfly needle, 18 gauze with one 10 ml dispo, 20 ml dispovan. Now,
then she loaded
and pre-warm media. Okay. Now we are ready for the procedure. We are doing Tesa. Under anesthesia, we have given the patient spinal anesthesia. It is a selective spinal anesthesia. We give a prick in the testis, and the assistant creates pressure, negative pressure, by dragging the piston of the needle, and with pressure we continuously go on pricking the testis several times so that the testicular tissue are accumulated inside the needle. Now after doing this for good number of times, slowly now you can see some seminiferous tubules are aspirated. So, and the assistant slowly with a forceps gradually brings the tissue outside, and the entire tissue is kept in a media. And the whatever tissue present inside the needle is also injected into the dish. Okay. Try to avoid the air bubbles. You can suck out the air bubbles by puncturing with the needle. Now you can see that this is the tubules which we have got. Now after that, it is being handed over to the IVF lab, where our embryologist will receive it and do the teasing of the sample. He collects the tissue in a dish. He is now teasing the tissue. The collected tissue contains good number of RBC and all, so he will first extract the tissue, clean it, extract it from the accumulated blood, then he will tease the sample with a needle. Now the teasing process is over. Some media is added into the sample, and now we are ready to see the sample in the ICSI microscope. So So this is the Tesa sample being examined under the microscope.
This is the sperm.
Okay. We'll try to find out whether there are spermatozoa in the sample or not. We go on searching till we find some spermatozoa in the sample.
Two. 10. 10 plus not 10. 20. Sperm kai? Aja. Jadi buat apa? Kalau ada apa? Apa dia? Tidak.
See, this is a good spermatozoa, but it is immotile. So immotile doesn't mean that the sperm is dead. Now we have another sperm here. You can see this is another spermatozoa that is also immotile. So we'll take out those sperms from the sample in a needle, place it in the dish and do a Horse test in order to know whether the spermatozoa are living or dead. So unless we do a Horse test, we cannot know whether the spermatozoa is living or dead. And from these spermatozoa which are living can be used to perform a ICSI procedure. Okay. We have to, out of all the immotile sperms we get, and we do a Horse test where we get a curving of the tail. So they are all live spermatozoa, and out of those live spermatozoa we select the morphologically better spermatozoa, the sperm whose head, neck and tail are morphologically normal.
This is having a double tail.
So this is not a morphologically normal spermatozoa. See, there are two tails here. Okay, there is splitting in the tail. So this is not a morphologically better sperm. So like this we have to look for as many spermatozoa as we have oocytes collected during pickup. So if we get that many spermatozoa, then that is enough to do a ICSI procedure. So all those azoospermic male where we diagnose them as obstructive azoospermia, even in few cases of non-obstructive azoospermia, we can go for this procedure, Tesa, testicular sperm aspiration, and find spermatozoa and use them to do ICSI, and with ICSI we can develop our embryos so that we can later transfer them to give a pregnancy to the couple, their own biological baby. Thank you.